All right, today we are going to be going through a PDO lifting procedure for an eyebrow lift. As you can see here, we're just sort of determining our treatment plan, what will give us the best lift. And so we're marking appropriately. You can see we have two vectors from our first entry point, and then we're going to add in a third towards the tail of the brow to really help accentuate that lift that we're going to get from the brow. Sometimes this will vary side to side, patient to patient. Certainly the vectors are never going to be the same patient to patient, but my approach for the left side versus the right side could be completely different. And for this patient who has a pretty significant asymmetry in her brows was definitely a different approach side to side. So we're going to start the procedure here. We're injecting her with a little bit of lidocaine. We are using lidocaine with epi, which I tend to do to try and control some of the bleeding that we can experience. So you will see a little bit of the white blanching at the entry point. And now we're going to create our pilot, which is where we will pass both our anesthesia, our local anesthesia, and then the thread itself. So we're just creating a little entry point, as the cannula that we use is blunt. So you need to gain some access to the tissue. So during this procedure, the patient did have a reasonable amount of bleeding from her entry point. And so I'm just applying pressure to try and get that to stop a little bit. In general, once you can get your cannula in there, it tends to be less of an issue, but it's all about being able to see your entry point, especially when you're in the eyebrow like that. It could be a little trickier with the eyebrow, finding that spot. So I've got my cannula in, and now you can see it's less of an issue. So we're just advancing the cannula up the forehead so that we can give her some local anesthesia prior to the thread. The best advice here for local anesthesia would be to provide the tiniest amount. You want to give them some to make them comfortable. However, the more fluid is in the track, the less of a pull you're going to get. So if you put too much fluid into this track, there's a chance that the barbs might not actually engage, and you're going to pull out your thread and it's still going to be on your cannula. It would never have engaged into the tissue. So we're really giving really tiny amounts here just to make her more comfortable. But again, we don't want a whole lot in there. Otherwise, you won't get as much of a lift. And we're going to do our next tract as well. You can see the patient's pretty comfortable through all of this. In general, working with a cannula, the patients tend to be fairly comfortable. I think most people think the sensation is more creepy crawly than pain, but you can see she's nice and comfortable, especially since we anesthetized our entry point with some lidocaine. And now it's time for our Vsoft lift thread. So for this particular procedure, we are using a 21 gauge by 60 millimeter barb thread for the brow lift. The 60 millimeter is generally the perfect length for this area. If you're using a longer length thread, you end up having to cut a lot more of the thread after the procedure. Once you are finished, you have to cut a little more of the thread off. And the issue is you could be cutting a lot of the barbs off, which will then limit the lift you're going to get. So you can see I have all the way up, and now we're exaggerating the lift that we really want. So we're pulling that tissue upwards as we're removing the thread. And you can see here, as we sort of tugged on that thread a little bit, you could see the lift that she was getting just from tugging that thread. So we're doing our second vector at this point. Again, we decided 2 vectors would probably give us an overall better lift. For this particular patient, we were looking for an entire lift of the brow rather than the foxtail, which is when you just lift the tail of the brow. This is patient preference, so just be sure that you're doing a nice consultation with your patient prior to treatment and understand really what is the look they're going for. If they're looking for a foxtail, then you're going to focus all of your lift on the tail of the brow. but this patient overall was looking for a lift, a full lift. And so we now have our 2 threads in there, and you can see as we put a good amount of pressure and pulling on those threads, you really can get a lift. Now, keep in mind, they likely will look crazy for the first day or so. We want that. We want a really exaggerated lift because it's going to fall over the next couple of days. And by that point, it will really look nice and relaxed and you'll be able to assess the lift. But it's not uncommon for them to leave your office looking a little bit crazy, having maybe a little bit of dimpling in the forehead where those threads are really sort of cranked tight. And then that's generally a pretty good sign that once the brows settle a little bit, just with time, that they'll still have a lift. And then we're now going to place 1 thread just in the tail of the brow there. And the procedure is exactly the same. Provide a tiny bit of anesthesia and then place your thread. It's really important that you are identifying the superficial temporal artery. We are obviously wanting to avoid getting that. Otherwise, the risk is a pretty significant hematoma. So once you identify where it is, of course, when you're making your treatment plan, if you feel the superficial temporal artery where you're planning to go, then you're going to have to alter your treatment plan a little bit. Luckily, we are using an L-shaped cannula here. It's not a blunt tip cannula, a sharp tip cannula. You tend to experience more bleeding and bruising with a sharp tip than an L-shaped or a blunt cannula. So that does make me feel a little bit more comfortable in an area where there's a fair amount of vasculature that you could affect. And so just keep that in mind. As long as you're using a blunt or an L-shaped cannula, then you in general should be pretty good in terms of hematomas and things like that. Of course, unless you happen to hit like a pretty large vessel, you might run into some trouble. Okay, so take a look at that lift from side to side. Looks really good. Clipped the threads and cleaned her up good, and she is on her way. So we'll reassess her in about 2 weeks so that we're able to really see the final look. Thanks for watching.